Hello, this is Dr. Sonya, and this video is for any lady who's pregnant, and especially if delivery is on the horizon, or you're thinking about delivery. This is just to talk about that. My second one's birthday was this week, so it's on my mind. These things are on my mind, thinking about the delivery. Okay, so one of the most important things to take away: you are incredibly powerful, and this is like such a powerful experience. It is awesome and so cool, and that's true however the delivery goes. So, using medication, with medication, without medication, C-section, it doesn't matter. You're incredible, you're amazing, and you're powerful. I want to say these things in my kind of mind and thinking about how deliveries are portrayed in the mediascape, at least through my experiences. There's lots of yelling and screaming and swearing at your partner and things like that. And so just want to say, obviously that's kind of like Hollywood or a different way of, this is kind of done for an effect, but also, there's this kind of sense that it's a scary thing or has to be scary, I just want to think of it, put it out there to think of it in a different way, and to let you know that you are just like so awesome and so powerful, and your body is like amazing, and it has all this incredible intuition and can just do this like really amazing thing that kind of like for you or with you, and so with my first delivery, there were two things that came with my first delivery. One of my friends was talking to me. She had her baby without medication, and she said, you don't have to deal with all of the contractions at once. You just deal with the contraction that's in front of you. And so that idea of being present and knowing that, there was this thing that was really intense that would come, and I could deal with them for a few moments of that intensity, and it would relent. And that was a really helpful thought. She kind of explained it that way. You just sort of there are these waves of intensity, and you deal with the contractions as they come, but you also do get a break, even if it's short. You kind of get this kind of recoup time between, at least for part of the for the part of the delivery that's more of kind of the contractions part. And that was helpful. I found that kind of was helpful for me to think about. It ended up being sort of the case for me as well. Another thing that happened with the first delivery is my mother-in-law had suggested that I use a photo to kind of get my attention out, to help with managing pain. And so my husband finds this photo, and it was a magical photo. And so the reason it was magic is because this really cool message started playing the first time I saw it, and every single time I looked at it after. And the general message, or the gist of the message, was this: today is the day of celebration. Your light is going to be here soon. Your love, she's going to be here soon. This is, you can celebrate. You can feel happy about that. And so relax and make it easier for her to come. So she's coming today. Relax and make it easier for her to come. And so I would be, in the middle of this intense, especially as it progressed, painful contraction, and my body's reaction was to just clench. The reactive answer or response was to just kind of clench the whole thing. And then I would look at this photo, and I'd be reminded of this idea, today is the day to celebrate. It's a beautiful day, and then I would let my body relax, and then it would really help. So I don't know if maybe it was easier for the baby to come out, but I know that I felt better, and so that was pretty cool, pretty helpful. Then I got to a part of that delivery where I got into my head, and I really started to kind of push really intensely, but it wasn't in kind of line with my body. I wasn't really listening to my body. It was, like I said, in my head. And that part of the delivery was a bit more difficult. Thankfully, everything still went okay. But it was a bit challenging. It was a little out of sync. And then the second delivery came along, and so the message of sort of being, listening to my body was really strong leading up. And so I could take in that lesson from the first time. And so I was doing that. So listening to your body, listening to my body meant when it said move forward, I would move forward. When it said to walk, I would walk, or breathe, I would breathe. And so that was really helpful. And it was at the end, towards the end, doing these kind of like big pushes at the end. And oftentimes someone will be counting. And so someone got to the count of 10 and they said, okay, breathe, take a break. And so I did. And my body said, oh, nope, that wasn't, that you listened to someone else, listen to your body. They basically was saying like there was a little bit more in there, and the more power, this is like powerful pushing time and pushing with the body, and for as long as the body is saying to push was what I needed to do. And so the next contraction, I was pushing, and maybe the same call came out of like breathe, and I just kept pushing. And I think I did that 1 or 2 more times, and she came out. And I was so surprised. I was pretty amazed. I was like, oh, she's out. Yeah, so that's it. That's it. The whole message is that you're incredible, you're awesome, your body is incredible. This is an experience, like, just rewriting kind of the fear and the pain. It's like, just take away power, like awesomeness and power, and that's actually, what I hope for you to take into the experience, being present, listening to your body, listening to yourself. And yeah, it might be intense. It doesn't have to be. It might be hard. It doesn't have to be. It can have ease in it. It might be painful, but it doesn't have to be. It can have, pain-free moments or ways of managing the pain that are actually quite effective. And it can actually just be really wonderful. Of course, everyone's delivery is different. It's not going to be like mine. And so whatever it is, you will be okay. And I wish for you to have a happy, healthy, easy, wonderful, celebratory delivery. I hope that's your experience. Okay. Thank you so much. Bye-bye.